Okay, very good afternoon, everyone. And first of all, thank you very much to the Universiti International Foundation for the opportunity and also for the board. Okay, so actually I'm Dr. Mohana Sundaram from Universiti Teknologi PETRONAS, Malaysia. Okay, and my research area is basically mathematics, but don't worry, I'm not going to talk about the maths here. So I'm just going to share what we're doing right now. Okay, and we are more focusing on the computational neuro-oncology. Okay, where we use the mathematical model, okay, for the prediction of the tumor growth actually. Okay, so this is just my outline of my presentation today. So I'll start with introduction. I'll show the mathematical modeling and what we are doing in terms of the numerical techniques and some results based on the case study. Okay, so first let me just highlight what is actually the computational neuro-oncology. Okay, so of course I believe you know what is the oncology here. So basically what we are doing here is actually should be the interdisciplinary field, okay, the areas that involving the mathematical modeling, not only mathematical but also the statistical modeling together with the numerical approach and also the AI. So what we are doing here is we want to study the brain tumor, okay, and basically we are focusing more on the simulating the tumor growth and also to predict the treatment outcome and also to improve the decision making in the neuro-oncology. And the figure at the bottom that to show what is actually the brain tumor. The one on the left is actually the real brain. So this is actually the part of the tumor, and this is based on the scan, the MRI scan. So you can see that this is actually the tumor, the brain tumor basically. Okay, and this slide I just want to show the types of the brain tumor. So we have many types. Okay, so we have like meningiomas, we have gliomas and so on. So our focus are more on the glioma because this glioma is normally encountered basically for the adult patients, and most of the glioma is actually the high-grade glioma, which is quite dangerous, it's malignant actually. So our focus are more on the glioma types of brain tumor. Okay, so go to the next one. It's about the mathematical modeling. So the reason why we do the mathematical model is just to add the insight of the behavior of the brain tumor actually. Because last time when we do the syndication with the doctors, one of the concerns by the doctor is they're not able to come with a prediction, okay, the growth of the brain tumor, because that is the one of the parameters that normally they check whenever they want to come with the treatment actually, the strategy for the patient. So because of that, so we come with the mathematical model. So in terms of the mathematical model, we have many mathematical models. Okay, so I'll show one of that in the next slide. Okay, so one of that is the reaction diffusion models. Okay, so this is, I'm not going to explain detail here, and I just put the general form of the models. Okay, but this model can be expanded further, and this can be the linear, nonlinear problems, can be 1D, 2D, 3D cases. So it depends how we look at the problem. But our focus will be to compute the cell density actually. So that is what we are doing here. And of course the value of the diffusion, the D is actually the diffusion. The rho is actually the proliferation rate actually. So these two values actually we got it from the patient. So based on the model, we are going to have the patient-specific modeling. This means that we are not going to use one model to all the patient. So we are going to have the specific value for the D, capital D, and also the rho. So that is going to define the patient-specific modeling actually. Okay, and this model just to compute the growth of the brain tumor actually. Okay, like what I mentioned just now, so there's many models, so I just chose one example of that because of the time limitation. And in our work, so normally we use the numerical techniques, and so the reason why we use the numerical technique is more practical to solve the problems. And this is actually the stages, or we can call the steps that involve. So whenever you are dealing with the equation just now, so first we need to discretize, and then you need to solve the system, then you get it from the discretization process basically to get a final answer. But later on I'll show some of the results. Okay, and this is some of the method in mathematics that we can use it. Maybe some of the terms can be quite common. So for example, like the finite difference method, the finite elements. So all these the method that we can use to discretize the equation to get a system. And just to represent it, okay, so this is not a real picture, I just generated from the AI. The one on the left is just to show how the FDM works. This is one of the method, okay, for the discretization. The one on the right is for the FEM, finite element method. So I just want to explain this part. So if you look at the brain, so this, let's say this is a tumor. So this is how we do the discretization. So this is, we call it the meshing process to fit in the tumor actually. Okay, from here we can do the simulation and then we can predict the growth of that. Okay. Okay, and after we got all the meshing and so on, so we need to solve the system. So I just list down some of the common or well-known method that we can use it. Okay, for example, the classical, the Krylov and so on. And the reason why we focus, our work is most focused on this to come with the more faster solution, faster solver. The reason is whenever we do the competition, the time is quite expensive for us because whenever we do the competition, most of the time we need like weeks to find the solution. So we need the more faster solver, okay, to get the solution here. Okay, so let's go to the next one. So I just want to show some of the results here. Okay, and my apologies, I can't reveal some of the detail because this is actually from the real patient. So I just can show some of the scan here, the MRI scan. So this is how we do the prediction, the simulation actually. So let's say this is a tumor. So by using the numerical techniques, we are able to predict somehow, okay, with how the tumor growth. Okay, so this is just to show the example of that. So it depends on the time that we want to compute. So we can check how big the tumor will be expand or grow after 2 months, 3 months, and so on. Okay, I'll just show some example here. So this is based on the first patient. Okay, and this is based on the first patient as well, but what we did here is we do the 3D simulation. So we want to check, okay, in all the aspect of the direction X, Y, Z, how the tumor looks like. Okay, so I hope you can see the one in red. This is actually the tumor cell, and after a few months, so this is how the tumor cell looks like. Okay, so the reason why we do all the simulation is just to give the insight to the doctor, so at least they can come with a proper treatment to the patient. So that's the main reason why we do all the simulation here. And this can be my last slide. So this is another way. So by this time we apply the finite difference method, but also we are using the AI for the prediction. So we just do some kind of comparison. So with the finite difference method with the physics-induced neural network techniques. So we just do the comparison and we are able to predict the growth. And of course, whenever we do the prediction, we will do the validation. Okay, since it's involving the ethical, I'm not able to show all the results here. So I'm just showing in terms of the numerical how we do the simulation. So these are all the results that we get from the real patient. Okay, so with that, thank you very much.